Right. So, when we try to understand about health health plan configuration, so it's always important being into the healthcare environment when we are developing any healthcare solutions, etc. It's always important for us to understand about the HLP understanding, followed by the kind of standards, policies, and procedures, steps that are required for us to follow. In regard to the process of learning, it's always important for us to understand about the HLP, which majorly drives to the cost and as well as the timeline of implementation, followed by kind of upgrades or expansions or support for the projects, which majorly reduces the scope, followed by this whatever the organization of realizing some possibilities of any kind of cap systems, all that. So because of the health plan configurations, which majorly enable to deliver the kind of risk that can be reduced, followed by this, it increases the quality, maximizing the cost efficiency of the projects which are associated with implementing, maintaining, and expanding the use of rules payers, etc. So this is what something which health plan configurations are all about. When we are implementing this, these are the different service features we have. One is about the implementation service, which majorly focusing on how these services can be implemented. At the same time, LOB expansions, which is called a line of business expansions. What are the different lines of businesses that we have, and how are we expanding those, followed by any kind of new services that we have initiated so far. At the same time, whatever the capabilities that are to be expanded, which are about expanded capabilities in context to the quality care that we are providing to the patients, and the case management capabilities that we need to address here. Next, about the upgrades part, right? So upgrades in context to the healthcare quality services that we are upgrading to the next level, or else the kind of migration process that are involved. So migration from old legacy systems to the new system. So how this can be migrated, followed by any kind of growth needs. All these are the services which are involved when we are implementing health plan configurations in the field of healthcare. So from the configuration analyst point of view, so being into the healthcare environment, so these are all the service features which we must be knowing and which we should know. But when it comes to the policy configurations are concerned, followed by any kind of address configurations, these are the different types of configurations you must be knowing. One is about policy configuration, next address configurations or service set configurations or ACL configurations and all. So this one we are going to discuss in the next session.